All right, so we're gonna start our assessment, which is called still points. All right, so I'm just gonna start with the heels of your feet, and I'm just feeling for symmetry, quality, amplitude, and rate of your cranial rhythm. Feel it better on your right hand side. It's quite symmetrical. The rate is about an 8. I'm going to do the top of your feet. I'm going to score that about a 2 out of 3. Again, symmetry, quality, amplitude, and rate. Same thing, I feel it more on your right hand side. It is symmetrical. Quality is good. And rate, I'm going to rate, same thing, it's about a 8. I'm going to score it I'm going to give that one a 3 out of 3. So I'm just going to touch your shins, okay? You doing okay? This one is very symmetrical. The quality is great. Amplitude and rate are the same. Your cycle is the same. It's about an 8. That's a 3 out of 3. I'm going to come up to your thighs, okay? You're okay? Right here. Good job. Again, your score. Very even, very symmetrical. Amplitude's good. Rate. A little bit faster here, so about a 7 is your cycle. That means nothing to you, but it means everything to me, okay? So we're gonna score that one about a 2 out of 3. I'm gonna come right on your hips. Is that okay? Yeah? Right here. A little bit faster on your left hand side. We're gonna score that. It's a little faster, so the symmetry is not quite there. I'm gonna give that about a 1 out of 3. I'm gonna come to your rib cage right here. Is that okay? Might be a little ticklish. Is fairly symmetrical. I do feel it more on your right hand side than your left. The rate's fast like your hips were. I'm gonna give that guy a 2 out of 3, okay? Perfect. All right, and then we're gonna do your shoulders, okay? Just gonna touch right here. Okay. They are symmetrical there. The quality is good. Don't feel any issues. The rate's about an 8. I'm gonna give that a 3 out of 3. So I'm gonna do a couple different holds on your head, okay? That was a 3, 2, 1, 2, 2, 2. Perfect. All right. All right, you good? I'm just gonna put my hands right here. And just a little bit of pressure. I'm just gonna feel. I'm feeling what's called flexion and extension. Your movement of your cranial rhythm. Moving my hands. It's fairly, the rate's a little bit off. It's a little faster on your right hand side. 1. I'm gonna do another one, okay? You look right up at the ceiling for me. I'm just gonna hold the back of your head, okay? Great job. I'm gonna put my hand right here. You comfortable? Yeah. So what I'm feeling is like a clamshell motion. Do you know what a clamshell is? Yeah. Symmetrical, they're meeting at the same time. The quality is really good. You got a 3 out of 3. One more hold, okay? I'm gonna tuck my hands right here. And hold right here. Same thing I'm feeling for what's called flexion and extension. Not quite symmetrical. You are a little bit faster on your left hand side. It's going into flexion, and then on your right hand side it stalls in flexion before it comes up into extension. So it almost feels like it's wobbling a bit. All right. Good job. You're gonna sit up and I'm gonna explain everything to you, okay? So with some of those, what we call still points that I did to you, I found that one side was a little bit stronger than the other. Sometimes it was moving a little bit faster, especially when I got up to your skull. There was one side that seemed a little bit restricted. So what we're gonna do with our treatment is we're gonna try to improve that. So you have lots of bones in your head, right? And they're sort of fused together. What we're gonna do is we're gonna slowly sort of move them. We're not gonna push them together. We're gonna move them apart. And that's going to help with some of your headaches that you're having. You said you had a headache today, right? Yeah. And then you have a hard time reading sometimes and writing a little bit. Yeah. So that's just going to help get things moving. So what that is you have fluid that runs all through your body, up your spine. So we're just going to move it. We're going to gently move it. You might feel it, you might not. Okay. And then we're just going to try to relax and everything like that. Since you are not 12 years old, how old are you? 8.
I'm gonna be 9.
And you're gonna be 9 soon, right? So because you're under 12, there's a few things that we can't do, which you won't even know. It'll be fine. So we're just gonna work within my scope of practice, okay? What I can do as a therapist and what I can do on you as a kid, okay?
Okay.
All right, you might feel tired tonight. Your headache might get a little bit better before it gets worse, but you just tell me if anything feels funny, okay?
My headache is getting better.
Okay.
And if I get more tired, that means I'll just have a better night's rest because I'll just go to bed earlier.
Exactly. Do you want to lay back down and look up at the ceiling for me? Perfect.
Are you guys the same way I was earlier?
Yeah, same way you were before. Perfect. So we're going to start what's called a dural rock, okay? So I'm going to put my hand. It's called your sacrum. It's like right where your back sort of meets underneath, okay? So I'm gonna put my hand right there. Perfect. And I'm gonna put one hand right here. All right? And you just relax, okay? So same thing. I'm gonna feel for that fluid and just see how it's moving. So we're gonna do what's called a dural to rock and a glide. I'm just following it and glide, and I just sort of nudge it the other way. You feel that a little bit? Yeah. This is considered a global treatment because I'm working on a few parts of your body. And we're going to do the rocking motion. Almost like I'm I'm rocking you like a baby. So now I'm going to move on to what's called a local treatment, okay? So I've done this on you before. We're going to do the 4 diaphragms, okay? So I'm going to start right here. So I'm just going to switch my hand. And I'm just going to put it on top of sort of your lower tummy area. Oh, there's a bit of a yawn already. Hold here for a few minutes. How you doing? Good? So I'm going to move up. Usually I'd hold that a little bit longer, but for this case study, we only have 20 minutes. All right. This one is called your respiratory diaphragm. We're going to move up. I'm going to just put my hand right here on your like lay back. Just consider your C1, or C7, T1. I'm going to put my hand right on your chest, okay? Is it a little ticklish? Yeah? I'm just going to go really light to start. And I'm still feeling that sort of fluid and that rhythm to see where it's taking me. This one's important to open up because since we did some work on your head and with your skull and your brain, we don't want the pressure to build up. We don't want to make that headache worse, okay? How are you feeling? Good. Do you feel relaxed? Yeah. All right, so we're going to move on to your hyaloid, okay? This one might be a little weird.
I feel like that's going to be the most ticklish.
You think it'll be the most ticklish? Okay, so I'm going to hold the back of your head, called your occiput. Can you look up at the ceiling a little bit for me? Perfect. And can you swallow for me? Awesome. There you go. And now you just relax, okay? This one's also really good for headaches, okay? And it's good for speech problems if there's any restrictions in there. Doing okay? Yeah, not as ticklish anymore? Yeah. There's another yawn. It's good.
Yeah, and I also just had a long day too.
All right, so usually there's a 5th diaphragm that we would open up. It's since you're under the age of 12, we're not gonna do it. It's called your OCB. And it's a little intense. And you're sort of moving some things around quite a bit.
Like here?
Underneath.
Oh,
back
wait,
there.
over here, can I open it?
Yeah, so we're not gonna do that because you're not 12.
Okay.
All right, I want you to look up at the ceiling again. We are going to move on to your frontal bone. Can you guess where your frontal bone is?
At the front.
At the front, right there. Perfect. I'm gonna hold right here. Perfect. You just relax. You can even close your eyes if you want. What I'm doing is I'm touching really lightly with about 5 grams of pressure. And what it should feel like is that I'm lifting that frontal bone towards the ceiling. And this is good for headaches because it relieves tension. If there's any restrictions. Doing okay?
You probably have some tension.
You think you have some tension?
Because we did some running today.
You did do. You did some running today. Alright. You might not have felt it, but I felt it sort of go up towards the ceiling, and then it's floating around a little bit. Again, it's very, very light. Awesome. We're gonna go.
It felt like I could feel it after you pointed it out.
Really? That's cool.
Yeah.
Alright, so now we're gonna do your parietal bone, okay? So there's one on either side. So I'm gonna need you to look up at the ceiling again. Awesome. I'm gonna get you to clench your jaw for me. Go. Awesome. I just wanna make sure I'm on the right spot. Now you can relax. You just relax. You can close your eyes if you want to. What I'm doing is I'm just getting them engaged so they can feel me and I can feel them. And then I'm sort of slowly pulling it towards me. This is also really good for headaches. Bring them towards me. How are you doing?
Good.
Doing good? Alright. Did you feel that at all? Did you feel like they came towards up a little bit or not that one so much?
No.
No. Alright, so the last one we're going to do is for your temporal bone. There's a couple steps to this one, okay? And this one might tickle a little bit. This one's really good for learning disabilities, like if you have trouble reading and writing and things like that, okay? So I'm actually going to put my finger in your ears. Okay? You okay with that? You're good?
You can go on.
Yeah. Is that better?
Yeah.
So what I'm doing is I'm feeling for a wobble. Yawn there. Doing okay? I was gonna readjust a little bit. There we go. Same thing, I can feel it a little bit more on your right hand side actually, and it's wobbling back and forth. So So this is where it gets silly, okay? I'm gonna pull your ear.
Oh.
Not hard, okay? I'm gonna hold like this. I'm gonna pull down a little bit. Doing okay? Now I'm gonna let that one go and I'm gonna do the other side. Not very hard, is it? No. I'm gonna let that go, and I'm gonna do both at the same time, okay? Yeah. Awesome. How was that?
Good.
Is that okay? You're looking a little tired. So now we're gonna reassess a couple of them. So I wanna reassess those couple holes that we did on the head, okay? So can you look right up at the ceiling again?
Yeah.
Okay, I'm feeling for flexion, which means it goes down towards your feet, extension up towards your eyes. This is feeling much more symmetrical. It's moving at the same time, the same rate. One side is not faster. It's nice and strong. I'm gonna give that a 3 out of 3 now. We're gonna do the one where I hold the back of your head too, okay? And relax again. Awesome. And I'm gonna put my hand right here. So same thing, I'm feeling for flexion towards your feet, extension towards your eyes. Your symmetry, it's at the same time. The quality is really good. The amplitude is great. Rate was always good. Slow down a little bit. It's about a 9 instead of an 8. All right, one more. All right. I'm gonna hold here. Put your chin up just a little bit. Awesome. I'm just gonna hold here and feel again for the flexion and extension. That is feeling much better. It is even. It is symmetrical. Before your right hand side was sticking, and your left hand side was moving faster. Now it's moving at the exact same rate. Feels really good. I'm gonna give that a 3 out of 3 now. Perfect. How are you feeling?
Good.
Do you feel more relaxed? Yeah? You ready to maybe take a nap? Perfect. Thank you so much.
You're welcome.